Next, we're going to test reflexes for the upper extremity. The rationale for assessing reflexes: if someone has a nerve root irritation, the reflex may be diminished. Okay, so some type of cervical disc pathology or nerve root irritation, you'd want to assess reflexes in your special test portion of the exam to ascertain whether or not the reflex is absent or there. So the first reflex is C5. Okay. Before I start C5, the most common reflex you're used to seeing is L4, which is a patellar tendon reflex. Okay, that's an easy one to get. The reflexes for the upper extremity are a little bit more difficult, so it takes some practice. But the first one is C5, and that's the biceps reflex. So to find the biceps reflex, what you would do is find that biceps tendon and have the patient make a biceps muscle. And then you can feel that tendon underneath your thumb. Okay, and then once you have that, what you would do is, I usually keep my thumb there and have the patient relax, okay? And then what you do is hit the reflex hammer on your thumb. And you can see right there, if you look at her hand, a nice biceps reflex going on, okay? Next one is C6, which is for the brachioradialis. This is probably one of the more difficult ones to get. So what you want to do is cradle the patient's arm, okay? And then what you're going to do is about 3/4 of the way down the forearm, you're going to feel for the brachioradialis muscle or tendon, okay? And then you're just going to tap right on it, and then you see a nice brachioradialis reflex. The last reflex is C7, and that's for the triceps. So for the triceps, what you're going to do is, again, have the patient make a triceps muscle, so extend out, and then feel that tendon and have them relax. Place your thumb in that area, and you can see the triceps reflex. Again, you would be comparing these bilateral to ensure that they're the same from the injured to the uninjured. Always good to start with the L4 reflex because you want to see if the patient can relax, and if they can't relax at L4, you'll know it might be more difficult to get C5, C6, and C7. So those are the reflexes for the upper extremity.